Let's now think about stress incontinence with impact like jumping, double unders, or burpees, or any sort of jumping movement. So, quite often when it comes to jumping, what happens is a few things that I've noticed clinically. A lot of women will breath hold. So, when we anticipate that kind of high intra abdominal pressure from jumping, we hold our breath. So, and actually, that when we hold our breath increases tension and puts force down onto the pelvic floor. So, thinking about breathing strategies when you're jumping can be really helpful. What I say to a lot of my patients is try to remain upright and think about taking deep breaths into the sides of your rib cage, allowing that expansion out this way. And then a forced exhale, and this can help to mitigate pressure down onto the pelvic floor. So, continuing to breathe and exhaling as you land can be helpful for those sort of jumping activities. The next thing we might want to think about is how we land. In any sort of jumping activity, we want to use our midfoot. Our midfoot is in a high arch like this and it absorbs pressure up and down. So, if we can land on our midfoot, that can absorb some of the pressure and stop it going up into our pelvic floor. If impact is really challenging for you, there are different ways that we might regress it. If you are landing on two legs, we might want to think about landing on one leg. And the reason for that is there's less force from the floor if I land on one leg. So, reducing your jumping to one leg landing can help whilst you're just retraining your pelvic floor. Other things to think about are slowing it down. Slow the jumping down and see what happens. Other things to think about are not jumping as high. Now, this isn't forever, but this is just while we retrain pelvic floor. So, alongside changing the jumping slightly or modifying it with these things that we've talked about, we would want to be doing pelvic floor exercises. There are many other ways to reduce or change biomechanics with jumping or high impact loading, but it's very difficult for me to individualize this on those settings. So, this is just some tips that I would use.